The Affordable Care Act is landmark legislation. There's very little that was known about how Alabamians felt about all of this and how they were reacting to it, and we wanted to I guess, establish a baseline that we could, in the future, sort of compare how sentiments have evolved over time. I should say, with respect to the survey itself, we only look at people ages 19 through 64, those who are affected by the expansion of the Affordable Care Act. And the survey was conducted in October of last year. 84% of Alabamians have health insurance, 15% lack health insurance. Of those with coverage, almost 60% have employer-sponsored coverage. About 14% have non-group coverage. That's individual coverage that they purchase on their own. That's about double the percentage that you would see nationally. The other interesting point, given our age cohort, is about 13% of folks have Medicare coverage. And that seems to be an artifact of disability coverage. We asked a series of questions about people's knowledge of the Affordable Care Act. And again, focusing on those most affected, those that have non-group coverage and the uninsured. Amongst those that already have private coverage that they purchase themselves, about 50% claim that they know a lot or some about the exchanges. On the other extreme, those people who are uninsured are those who were 47% of the uninsured know nothing about the exchanges, and another 20% know very little. So amongst those that have skin in the game, if you will, because they have individual coverage, they know a bit more about the exchanges, the uninsured considerably less. We asked questions about the Medicaid expansion. We asked if people were aware of the decision Alabama had made to expand or not. And the survey results indicated that 27% indicated that Alabama would not expand, but over half said they hadn't heard what decision the state had made. We then asked them whether or not they thought the state should expand the Medicaid program. And there, what we find is 63% indicated strongly agreed or agreed that, in fact, Alabama should expand its Medicaid program. 20% disagreed or strongly disagreed with the expansion. We asked, think you're likely to be eligible for a subsidy? There, almost a third of the invincibles are aware that they may be eligible for a subsidy, but yet may not participate. And do you plan to buy coverage through the exchange? The group least likely to do so were those young invincibles, which suggests that concern about older, sicker people disproportionately joining the exchanges and joining the exchanges in Alabama may indeed be a real phenomenon that the exchange here has to worry about. We asked what are the most important factors amongst likely participants in terms of a decision to participate in the exchanges. The issues that are important, whether or not you were in the uninsured group or whether you had individually purchased coverage, is a low premium, provider availability, and out-of-pocket costs. Issues of quality ratings, trusting the brand name, are things that sort of dwarf pretty small relative to premium, availability of providers, and out-of-pocket costs. So we asked, if you look at the ACA, how would you know if it's a success or not? And do you support the ACA and the various provisions? In contrast to what we just saw about Medicaid expansion, the majority of Alabamians, 53%, said they did not support the Affordable Care Act. A little more than a third said they did. Then we asked questions about various components of the law. 50% believe that it's a good thing that individuals be required to have health insurance. 70% or so believe that large employers should be required to provide coverage. 65% believe that people with pre-existing conditions should not have to pay more for coverage. But in contrast, even though half think that there should be an individual mandate, only 15% think that penalties should be imposed to encourage people to get coverage. 72% think subsidies for low-income people are a good thing. And 2/3 believe that children being able to get coverage through their parents' policies up to age 26 was a good thing. How do you judge the success of the ACA? 30% of folks said that it was an affordability issue. How expensive is health insurance for me? Only 8% said that reducing the proportion of people who are uninsured was the measure of success. That's, in my judgment in any event, that's bad news for the ACA, because the one thing it's supposed to do is reduce the proportion of people who don't have health insurance. That doesn't seem to be a crucial issue among Alabamians. It's the affordability issue. The ability to keep your health plan matters a bit. The ability to keep your own physician matters a little bit, but clearly affordability is the primary measure of success in their judgment. So we asked, now that the exchanges are coming online, remember we're talking October, what do you think? Will there be a larger choice of plans, fewer choice, smaller choice? About 1/3, a little less, said there'd be a greater choice of health insurance plans available. But as you see, over 1/3 said there'd be a smaller choice. 20% or thereabouts said there'd be little change. We asked about your family well-being as a result of the Affordable Care Act. And we've broken that down amongst those who are uninsured, those that have non-group coverage, and those who have employer-sponsored coverage. The uninsured are interesting. About 29% said that they expect that their family is going to be better off as a result of the Affordable Care Act, but another 29% said they'd be worse off, and 30% or so said they just don't know. In contrast, the non-groups, those that are buying private coverage now, 55% said that they would be worse off. Amongst the employer-sponsored group, who arguably are perhaps the least affected here, only 10% said that they thought they would be better off. 28% said they'd probably be unaffected, but a majority, 52%, said that they thought their family would be worse off.